has kind of the evolution of society changed? It's obviously made this much more difficult due to society changing.
You know, we just had an active shooter incident in Lewiston, just north of here,
Yeah.
half hour north. It was quite a night.
Yep.
The reason Shortly after that, we started getting requests from every one of our hospitals. We need a camera here, a door there. We need armed guards in our lobbies, and all kinds of security aspects. And you have to draw the line and say, wait a minute, you can't just go and do everything that everybody wants. You have to have a collective plan. And that's the process that we're going through. And it's going to cost millions of dollars to upgrade the security throughout all of the organizations, from parking lot lighting to cameras, metal detectors at doors, lockdown access. Training people is probably one of the most difficult things. But Peter, you went down the road of the behavioral health folks, and that's a major league crisis for those folks, but also for everybody else. So as a result of COVID, a lot of care centers have shut down because they can't afford to pay the salaries. And people have moved on from working directly for a care center, hospital, whatever, and gone to working for travelers. The cost is prohibitive, and so many small centers can't sustain. So now what's happening is our emergency rooms are getting very overcrowded.
Yeah.
Um, and there's no second level for people to go to. So I was thinking about, tying this back to the JFK situation, or a visit from a dignitary that we've heard stories about. They evacuate a whole floor and the president takes over the whole floor of the hospital. Well, we're a 700 bed facility here, and we had 730 patients last week. So how do you possibly
Yeah.
evacuate a whole floor for the sake of one person? You can't do it. It's not morally right.
Yeah.
So yeah, things have changed major league. And a good part of it comes back to the horrible behavioral health situation that we have in this country.
Fact.
It's to Dave's point, it's huge. We have patient safety calls every day, and then we flag patients that we know um, that might have a workplace violence issue or behavioral health issue, and we talk it after our patient safety call. It's just a rundown of all the safety alerts from the day before, and if people need help, it's a cadence we started many years ago, right before COVID. It's worked very well for us.